Hello, my name's Charles Dixon. I'm the new clinical lead for the Listening into Action approach for the Trust. I'm also a consultant psychiatrist who's based in Exeter, working in the inpatient unit and crisis team looking after people from East Devon. I want to talk to you today about the Listening into Action approach that the Trust has adopted and perhaps explain for you exactly what it means and what it's about. So I think if I could start by saying that the Trust has recognised that it's got a bit of a problem. I think that the NHS staff survey has shown that as an organisation we're not doing as well as we could do in terms of staff engagement. We came in the bottom 20% for staff engagement. We also, perhaps more worryingly, came in the bottom 20% of mental health trusts for staff recommending it as a place to work and saying that they'd be happy for their friends or family to be treated by this trust. And that's obviously a concern for us as we want a happy workforce, but it's also a concern for patients because there's a lot of research that show you get better patient outcomes if you have a happy, motivated workforce. So that's the difficulty. So I'm pleased to say though that we want to try and improve things, and in looking for the best way to improve engagement, the Trust has looked to the Listening into Action approach. And this is an approach that's been used by lots of trusts around the country with some really good results in terms of staff engagement and improving patient outcomes. So I thought I'd tell you a little bit about the Listening into Action approach. Some of you will have already been to some of the big staff conversations and will have heard a bit about what's happening, but some of you may not come across it yet. So the main thing about the Listening into Action approach is acknowledging that the staff we have a huge wealth of experience who are motivated to try and improve things, but somehow our policies and procedures and management structures sometimes get in the way of those frontline staff making the changes that they know need to happen to improve patient care. So the Listening into Action approach gets that group of staff, the frontline staff, it gets them to talk about what's getting in the way of improving patient care, and then it flattens the hierarchy and gets the senior management team enabling those staff to make those changes actually happen. So the first phase of that approach is the big staff conversations. We've had 5 already, we've got 1 more coming up. As I say, you may have been to some of them. Overall, we're going to have over 600 staff feeding back to us about what gets in the way of them improving patient care and how they think that can change. Now, you might say, surely this happens already, surely we should be listening to staff. And yes, you're right, we should. And yet somehow when we've tried to do this in the past, I think we've listened to staff, but something's gone wrong and then things actually changing. So the big difference here is, once we've got all that feedback from staff about what's happening, we have very genuine sign-up from the senior management team about enacting those changes and making sure they work. And Peter Cubbin as chief exec and his team are incredibly committed to this, but also I'm in the very lucky position of now being full-time as the lead for that, for this approach, in making sure that it actually happens, and I'm going to hold Peter Cubbin and the board to account for if they say we're going to be able to do things, they've got to follow through and make sure this actually happens. So we've almost finished the big staff conversations, and we're going to compile all that feedback. So then what's the next stage? Well, the next stage is going to be 3 things. When we've looked at that feedback, the biggest things that are concerning staff, and I can tell you there are already a lot of themes coming through. Some of them are kind of county-wide themes that are organisational, but some are actually very local things which, on the face of it, seem very small, but can cause a lot of frustration for those staff that are coming up against that problem. So what we're going to do is we're going to have, in the first instance, identified 10 teams that are going to work on 10 frontline problems that are getting in the way of good patient care. And we're going to empower those teams to really look at what's happening, what's getting in the way of improving that service, and then make sure that they're able to make those changes that they say need to happen. The other thing we're going to do is to look for some quick solutions to perhaps some of the smaller problems that are ever so frustrating in daily life, but that with the right push and direction and commitment we can quickly solve to improve working life and patient experience. And then the third stream is one which is called enabling people, and that's at things that are a kind of wider organisational level, for example, IT systems. And that's a situation where, as well as having frontline staff solving the problem, you also need people from, say, the IT department or the buildings department who can actually make sure and help those staff know what can be achieved and how to make that achievable. Now, the other important part about this approach is we can't just stop there. We can't just have these 10 teams and then say, oh, that's made some changes and rest on our laurels. The next really important thing is to embed the listening into action approach in the culture of how the organisation does things around here. So what we also want to be doing is we don't want to just stop with those big conversations. We need to be constantly getting feedback from staff, and we need to be looking at how we solve day-to-day difficulties, how we design services, by making sure that they are designed by frontline staff, supported by the management, and not the other way around. So I'm hoping, and we're hoping, that this is going to really be embedded in the trust culture. I'm very keen to get out there and meet as many of you as possible. I want to hear about your ideas. I want to work with you and your teams about how you can shape change and how you can use your ideas to improve the trust. And I think that way we're all going to have happier working lives, and we're going to give a better service to our patients, which I think is what we're all working for the NHS for, really. So thanks very much for listening. I hope to meet many of you soon, and please feel free to contact me, either give me a ring or send me an email, and I'm hoping to get round to as many of your team bases over the next few months as possible. Thanks very much.